Assalamu alaikum warahmatullahi wabarakatuh. Today we will discuss the certificate section. First, what is the certificate? The certificate is a document made by the doctor indicating the death of someone and mention the cause, the time and the place of death. So it's very important. Second, written in which language and why? Do you think what is the best language to be written in? The mother language. This document can be handled by anyone except doctor, the relative of the patient, the relative of the victim, and the police, the court. Many people will handle this. So it must be written by the mother language. In Egypt, it's in Arabic, and in Malaysia, it must be in Malaysia language. Who writes the certificate? First, the doctor in the primary healthcare unit or the specialized officer, but in cases without criminal suspicious. But in cases with criminal suspicious, it must be done by the forensic expert. So, if there is a case of death and reported to the physician, the dead body must be examined by the physician and he examined either there is criminal suspicion or not. If there is no criminal suspicion, write the death certificate and the body is buried. But if there is a presence of criminal suspicion, don't write the death certificate and the police must be notified and the examination of the body made by forensic expert. What is the importance of this certificate? Why it is important to write it? First, logically, from the medical legal importance, it's very important. Second, improving and establishment prevention and treatment projects. Many projects to prevent diseases or events that cause this, depending on the causes of this, really revealed from the this certificate. So as it's very important to for prevention and treatment programs, WHO published a format for this certificate. This is a photo of a test certificate in Malaysia. The information must be written inside the certificate included first diseased information about deceased particular, including name, sex, religion, nationality, age, marital status, place of residence, identity card, place of death, date of death, and time of death. And the informant, the person informing the authorities about the death of someone, including name, identity card, and relationship. What's his relationship with the deceased person? Second part is the main part of this certificate. The main part done by the doctor, including two parts. First part, immediate cause of death, which is A, and conditions, if any, leading to immediate cause, including B and C. So, C causing B and B causing A, which is the immediate cause of death. So, part 1 talking about the immediate causes of this and what's causing it. C caused B and B caused A. But part 2 including other significant condition contributing to this, but it's not resulting in the underlying cause. Okay. The last part in the death certificate including doctor name, signatures, and date. Let's have an example. An elderly pedestrian with chronic heart failure was hit from the back by a car. She sustained bruises of right leg. She confined to bed and died after 10 days. Autopsy showed a massive pulmonary embolism with thrombosis of the veins of the right leg. To solve any case of this certificate, you must first arrange the events in chronological order. Second, you must determine what is the last event occurred before this. In the previous example, this has a chronological manner. First, what's first happened? The patient or the victim hit from the back by a car and he confined to bed for 10 days. So the first event to be occurred is long bed recumbency after car accident, which causing a thrombosis of the veins of right leg. This thrombosis, a detached thrombus from it, impacted in the pulmonary blood vessels, causing pulmonary embolism, which is the last event before this, which is the immediate cause of death. But here we mentioned that the patient suffered from chronic heart failure. Chronic heart failure, it is not the immediate cause of death, but it contributed to this. So, to solve this problem, part 1, A would be the last event before this, which is pulmonary embolism. B, what caused A, which is thrombosis of the veins of right leg. C would be long bed recumbency after car accident. So C cause B and B cause A, and A is the last event before death. Part 2, including chronic heart failure. It is a significant condition, may contribute to death, but it's not the cause of pulmonary embolism, not the cause of death. So, in the exam, you must write this in this format. Don't mention A, pulmonary embolism, B, thrombosis of the vein, C, long bed recumbency only. You must mention the title of each item. You must mention immediate cause of death, A, and write your answer. Condition, if any, lead to immediate cause, B and C. Part 2, other significant conditions contributing to death but not resulting in the underlying cause, and write your answer. Don't forget to write the titles of each item. Let's have some notes. In the previous example, the cause of death was stated clearly and mentions the cause of death is pulmonary embolism. But in life, and sometimes cases, I can mention it for you, for exam, the diagnosis is not mentioned clearly, but I can give you signs and symptoms that help you to diagnose the cause of death. For example, I can mention you any signs or symptoms of pulmonary embolism like chest pain, hemoptysis, tachycardia, tachypnea, hypotension, cyanosis. If I mention 2 or 3 of these symptoms, this indicate for you it's pulmonary embolism. So when you write your answer for immediate cause of death, it should be pulmonary embolism, not chest pain or not hemoptysis or tachycardia or whatever. Let's have an example for this. An elderly pedestrian was hit from the back by a car. She sustained bruises of right leg. She confined to bed, and after 10 days, she complained of severe chest pain, dyspnea, and cyanosis. Then she died. Here I mentioned you severe chest pain, dyspnea, and cyanosis, which indicating pulmonary embolism. So A would be pulmonary embolism. What is the cause of pulmonary embolism? This patient is confined to bed after a car accident, which causing thrombosis, that's a chronological manner, thrombosis of the veins of right leg, which causing pulmonary embolism. So B would be thrombosis of right leg veins. C would be long bed recumbency after car accident. Now, what can we write in part 2? It's nothing. In the previous example, I mentioned that the patient had chronic heart failure. In this case, I didn't mention anything. So, if there is nothing to be mentioned, write nothing. Don't leave it blank. Attention please for very important note. Don't write the signs or symptoms of the disease, but write the diagnosis. Like previous example, don't write chest pain, dyspnea, or cyanosis, but write pulmonary embolism. It's a diagnosis, not signs or symptoms. We have golden rules that help you in solving the death certificate problem. First, arrange in chronological manner. A would be the last event and the immediate cause of death. B causing A and C causing C. Don't write any signs or symptoms. Don't write any terminal mechanistic events. Don't write cardiopulmonary arrest or asystole. Any patient, whatever the cause of this, will pass on these events. It's a terminal events. Don't write the manner. This certificate is not the place we write the manner, homicidal, suicidal, or accidental. If there is no entry on B, C, or part 2, write nothing. Don't leave it blank. It's very important note. If there is nothing in B or C or part 2, write nothing. But it must be at least A. Immediate cause of this must be written something. You have a diagnosis, a cause of this in this part. But B, C, and part 2, if you can find no entry in this parts, you say nothing. Let's practice together. A diabetic man who had been on a therapy for atherosclerosis and angina suddenly suffered from chest pain radiating to the left arm, dyspnea and sweating. He was diagnosed coronary artery occlusion and myocardial infarction, but he died. Here the diagnosis is stated clearly: coronary artery occlusion and myocardial infarction. So what is a immediate cause of this? Acute myocardial infarction caused by coronary artery occlusion. Coronary artery occlusion caused by the atherosclerosis. What's in part 2? Here I mentioned this victim was a diabetic. So part 2 will be diabetes mellitus. A child 7 years old suffering from a traumatic heart developed subacute bacterial endocarditis. On the third day, he developed hemiparesis, followed in the afternoon by coma. The diagnosis was cerebral artery embolism and he died. Here I write you the immediate cause of this, and which is cerebral artery embolism. But what is the cause of cerebral artery embolism? Subacute bacterial endocarditis. Okay. What is the cause of subacute bacterial endocarditis? Rheumatic heart disease. Here mentioning hemiparesis and coma, it's a manifestations of embolism, cerebral artery embolism. These signs or symptoms don't be written. The diagnosis is cerebral artery embolism. So A will be cerebral artery embolism, B subacute bacterial endocarditis, C rheumatic heart disease. Part 2 will be nothing. I didn't mention any significant disease that can cause this, but it is not the exact cause of immediate death. An anemic pregnant female came to the hospital with severe vaginal bleeding. On examination, the cervix was dilated and was diagnosed as inevitable abortion. What is the immediate cause of this? The bleeding, severe vaginal bleeding. What is the cause of severe vaginal bleeding? Inevitable abortion. C would be nothing. Part 2 would be anemia. Anemia don't cause severe vaginal bleeding, but it contributes to death. An old man was suffering from diabetes and hypertension for 10 days. He developed a carbuncle in the gluteal region. Then he passed into septicemia and died. So the immediate cause of death would be septicemia. What is the cause of septicemia? A carbuncle in gluteal region. What is the cause of carbuncle? It's commonly known that diabetic patients, it's very common to develop carbuncle in their bodies. So we can say that the diabetes mellitus would be the cause of carbuncle in the gluteal region. So A would be septicemia, B carbuncle in gluteal regions, C diabetes mellitus. And in part 2 we mention hypertension. Hypertension may contribute to this, but it's not the exact cause of the immediate cause septicemia. Another answer would be septicemia caused by carbuncle, and we write diabetes mellitus and hypertension in part 2. Both answers could be accepted. A patient was admitted to fever hospital where you are working suffering from fulminant viral hepatitis. He gave past history of passing renal stones and bronchial asthma. By the afternoon, he passed into coma and died on the next morning. This patient died from coma. This coma is a sign of what? Fulminant hepatic failure. Fulminant, which caused by nothing. But part 2 I will mention the renal stones and bronchial asthma. It's not related to hepatitis, but it contributes to this. The following example, I will give you a second to solve it and we will discuss it together. Don't forget, you must write it with the title. Don't mention A or B or C. I mentioned it in the previous example and in the next example to save time, but in the exam you must write complete the titles. Immediate cause of death, conditions if any leading to immediate cause, and part 2 other significant condition contributes to death but it not resulting in the underlying cause. Don't forget, it's very important, very important. One-year-old child suffered from acute gastroenteritis with sunken eyes and cold skin. Dehydration was diagnosed. He received fluid but died a few hours later. Here, the last event and the cause of this is dehydration. The cause of dehydration is acute gastroenteritis. C nothing, part 2 nothing. "55-year-old man complained progressive severe headache for 1 week. 1 week ago, vomiting started. On examination, papilledema was detected. A localized swelling in the brain was diagnosed by CT scanning. After 1 day, he passed into coma and died." Here, what is the cause of this? Vomiting and papilledema and the presence of swelling on CT indicating brain compression, which caused by swelling in the brain. C nothing, part 2 nothing. An old man fell downstairs. He suffered from comminuted fracture of the femur. Plaster sprint was done in less than 24 hours. Then he developed severe chest pain, dyspnea, cyanosis, and shock with blood pressure 80/50, and was diagnosed as fat embolism. On his way to hospital, he died. Here the diagnosis: fat embolism, but it is pulmonary fat embolism. Presence of manifestation of severe chest pain, dyspnea, cyanosis, and shock is indication of pulmonary embolism. Here its specific type is fat embolism, so it's pulmonary fat embolism. What is the cause of pulmonary fat embolism? Presence of comminuted fracture on the femur. It's a common site to cause fat embolism. What is the cause of comminuted fracture? Fall on the stairs. Part 2 would be nothing. "55-year-old bilharzia man developed viral hepatitis. Few days later, his condition deteriorated. His investigations revealed a high level of ammonia with deteriorated liver functions. Then he died from hepatic failure." What is the cause of this? Hepatic failure. It's mentioned, stated clearly. Hepatic failure. What is the cause of hepatic failure? Viral hepatitis. And C would be nothing, and 2 would be bilharziasis. Bilharziasis, it is not a cause of viral hepatitis, so it must not be written in C. Okay, it's not in the bilharzia don't cause hepatitis. Okay, there is another answer. It would be A, hepatic ammonia intoxication, then hepatic failure. C would be viral hepatitis, and bilharziasis still in part 2. An alcoholic patient fell down on uncovered active electric wire. He died at once. It's a case of electrocution. B nothing, C nothing. 2 will be alcoholism. A hemophilic child was playing with pillows when he was struck on the left temple by a stick. He staggered and fell momentarily concussed, but got to his feet. Next morning he was found unconscious with signs of lateralization. On his way to hospital he died. This is a very important case. It's related to head injuries. Okay, the patient was concussed, then there is a lucid interval, then he become unconscious and with signs of lateralization. So what is A? What is the immediate cause of this? It would be brain compression. What is the cause of brain compression? The hemorrhage. He was struck on the left temple by a stick. It's a common site of extradural hemorrhage. The extradural hemorrhage caused by the head trauma. And hemophilia, it's held in this, but it's not the exact cause, the immediate cause of this cause of brain compression, so it would be in part 2. During playing of one baby by a coin, he aspirated it on his trachea. He became cyanosed unconscious. He received treatment in emergency room, but he died. During autopsy, we found deep blue hypostasis, the right side of the heart, great vessels were congested, and also the lung was congested. Here, During autopsy, the hypostasis and the congestion on the heart and the great blood vessels, also the lung was congested. This is indicating asphyxia. But what is the cause of this here? A coin. This coin impacted in the airway, causing asphyxia. What is the name of the diagnosis of this condition? Shocking. Shocking. So A would be shocking. Shocking caused by aspiration of foreign body coin into trachea. C would be nothing. Part 2 would be nothing. An alcohol addict man was found dead in a smoke-filled room. He had sustained moderate burns on his right hand. On examination, skin was red in color, alcohol level was 100 mg%, and carboxyhemoglobin level was 80%. It's clear. C, all poisoning. It's high level of carbon monoxide level. Okay. B, nothing. C, nothing. But part 2 would be alcoholism. Chlorine gas cylinder exploded in a factory. 10 workers got chlorine toxicity. One of them was severely cyanosed. She died from laryngeal edema. It is stated clearly, laryngeal edema. What is the cause of laryngeal edema? Chlorine gas toxicity. C, nothing. Part 2, nothing. Thank you. Feel free to ask any question and communicate easily at any time. And thank you for listening.